Hi there, welcome back. It's so nice to see you.
Nice to see you too.
It's been almost a year since we last saw each other, and I just wanted to ask, how are you doing overall?
Yes, it's pretty good. I am busy for the work, except that, and also I'm doing others and relax myself.
Good. And so in terms of your stress levels, how would you say you're doing from 1 to 10, 10 being the worst amount of stress?
Yeah, I think it's about 5.
Okay, not bad. So what are your main sources of stress?
Yeah, it's except the work, and most time I'm just every day morning I'm doing the exercise. And also is sometimes play the guitar, sing the song, and sometimes I drink a little bit.
So this is to help you like kind of reduce your stress levels.
Yes.
These are the things that you do.
Yeah.
Sounds wonderful. Now make sure you don't drink too much alcohol, but I think you're playing music. You said do you play the guitar, you said?
Yes, I do sing a song, and my national songs, other song,
That's wonderful. I think that's a really great way to really connect with yourself and connect with others and keep yourself happy during such a difficult time. So I'm really proud of you for doing that. Let's go ahead and start your physical exams. Is there any changes to your health that you'd like me to know about?
Yeah, all this doesn't have, so it's almost normal,
Okay, so not many changes? All right. Okay, please place this under your tongue and then close your mouth. Let me take a look. Okay, 36.41, no fever. That's great. I'd like you to raise your hand all the way up to the top and 10. Yeah, pump it 10 times. Good. So on your left side, it's 140/80. I'm going to check your right side as well.
Okay.
Have you been checking your own blood pressure regularly?
Yeah.
And how has it been?
Yeah, about around 50, 80, like that.
Okay.
Sometimes 140.
Okay, I see. Same thing, raise your hand all the way up. 10 times, please. Relax your hand. So on your right side, it is currently 148 over 80. So it is quite high. Are you taking your blood pressure medication?
Yeah.
Okay, so continue taking that, and I might actually change the dose a little bit.
Okay.
Make sure that you're continuing to exercise, that you're continuing to reduce your stress levels.
Okay.
Drink plenty of water. Okay? All right. And also to have a good healthy diet, eat lots of fruits and vegetables. This can potentially help as well. All right. Just take your pulse, you just relax. Just make a few notes. Now I'm going to go ahead and inspect your scalp and your skin.
Okay. Have you had any issues with your hair or your head? Any problems with your head or your hair? No.
Okay. Sorry, I kind of messed it up. Let's make it look good again. back here, right? Just inspecting to see if there's any nevi that are potentially concerning. Okay. Okay, let's see here. And you're turning 60 this year, yes?
Yes.
How do you feel about that?
Yes. Still, I think I'm young.
That's great.
Yeah.
All right, you still have a nice full head of hair. There's a little bit of thinning at the top, but overall, still quite good.
Yeah.
I haven't seen any issues with your scalp, any redness or any patches, any nevi that are concerning. So yeah, everything looks good here. It's great. I'm just going to take a look at your face, okay? Okay. I'm just going to press down. Let me know if you feel any pain here. Any pain?
No.
Okay, good. Any pain here?
No.
Okay, those are your sinuses. There's no issues there. Eyebrows look good. Okay. Let me know if you feel any pain or tenderness,
No.
okay? Okay, I want you to open your eyes. Take a look here at your conjunctiva. Okay, no jaundice, no paleness, and also no signs of conjunctivitis, no discharge in the eyes. Really good. Okay. Okay, let's take a look at your neck area. Alright, I'm going to go ahead and palpate your lymph nodes. So I'm going to start with the occipital back here, then the tonsillar, mandibular, submental, anterior cervical, posterior cervical. I'm going to go in a little bit deeper. Okay, just relax right there. Good. I want you to shrug your shoulders like this. Supraclavicular. Okay, relax. Infraclavicular. Good. Okay. No issues there. Let me take a look at your thyroid, okay? Can you swallow, please?
Open more.
Like swallow. Okay. Just noticing actually a tiny little lymph node there, but it's not enlarged. Is there any pain here?
No.
Okay. It's interesting that was right on top of the thyroid tissue, but it does seem to be separate from it. There are no issues with the thyroid. That's good. I'm just going to check the trachea as well. Make sure there's no deviation. Great. All right. So let's continue with an eye exam. Just look straight ahead, please. Okay. I don't see any problems with your lens, iris, or your sclera. Let's look on the other side. No issues here either. Now I'm going to be checking for your pupillary constriction. Good. Okay. Look straight ahead, please. Good. All right. Now I'd like you to just look at the pen, the tip of the pen here. Okay, just keep looking at it, and then look back at that wall, back at the pen, keep looking at the pen. Great. No issues with accommodation or convergence. Now I'm going to do the H test. I just want you to follow again the top part of the pen here. I'm just going to move it. I don't want you to move your head. Just move your eyes, okay? Okay, so try not to move your head, okay? Just your eyes. Good. We're just testing cranial nerves 3, 4, and 6. Great. All right, so now I'd like to check your peripheral visual fields. I want you to close this eye right here and then look directly into my eye. And so don't look at my hands, just look into my eye. Tell me when you start to see the tips of my fingers. Once you see this, this part, let me know, okay? So don't look at my fingers. 1 second. Let me know when you see it, okay?
I see.
Don't move your eyes, just look at my eye. One more time.
I can see now.
Good.
I can see now.
Good.
I can see.
Good. Oh, same eye.
I can see.
Good.
I can see now.
Okay.
I can see now.
Okay, switch eyes.
I can see.
Good.
I can see. I can see now.
Okay.
I can see.
Okay.
I can see.
Good. So just look in my eye.
I can see.
Great. Okay. Just going to make some notes again. No defects of the peripheral fields. No defects of cranial nerves 2, 3, 4, and 6. Okay. Next, we're going to do some ophthalmoscopy. Just give you a moment to rest. I'll go on your other eye. Okay, so again, look straight ahead at the wall. Just checking for your red light reflex right now. Adjusting the... There you go. Alright, I can see the optic disc with a clear outline following the blood vessels. Okay. Move on to the other eye just for a moment. Okay, so on this side, your optic disc looks great, clear outline. I don't suspect papilledema. The cup to disc ratio is good as well, so I don't suspect any glaucoma. Your arteries and veins, there's no nicking, there's no hemorrhaging, there's no spots. The retina color is normal as well. I'm just going to take a look at this eye one more time, okay? Just keep looking straight ahead. Good. Alright, so your retina and your optic disc and cup also look perfectly fine on this eye, so nothing to worry about. So I'm going to go ahead and palpate your ears. I know you've had issues with your ears before. Can you remind me which ear it was that you used to have infections?
Yes, before I have infections.
Which ear was it? The right or left?
I think that's left one.
Left side?
Before, yeah.
Okay. Any issues here?
No.
What about
No
here?
problem.
Okay. And this side? Any pain?
No.
What about this?
No.
No? Okay. Have you had any trouble with your hearing?
No, it's normal.
Normal?
Yeah.
Okay, good. Getting sleepy? Let's take a look inside. Okay. Cone of light, anterior and inferior, present. Malleus is present. Pars flaccida intensa. No issues there. The center of the tympanum, there is a little bit of like red vascularity. Clear ears, no cerumen present. That looks quite healthy overall. Let's look at this here now. The one that you've had trouble with before. Okay. The cone of light is quite reduced actually. It's still anterior inferior, but not as present as in the other ear. It does seem to be a little bit cloudy on the other side, not as translucent. There's quite a bit more erythema on the tympanic membrane, especially on the anterior superior area, kind of where the malleus handle is. The bony landmarks are not as visible. Most of the erythema is on the pars flaccida. And there's a bit of erythema in the canal as well. And I do see, it looks like there are a few hairs kind of internally close to the tympanic membrane. There also seems to be a furuncle in the canal, but no signs of cerumen. Is there any pain in this ear when I went in?
No.
Okay. I would definitely still be careful of this ear. Are you using any cotton swabs?
Yeah, sometimes.
Please try not to. This ear seems quite susceptible. There's still some cloudy discharge on the other side. There's still some kind of redness. So I would just be really careful with this ear. Okay? And let me know if you feel that you have any infections. I can definitely help you with that. Just gonna take a look inside your nose, okay? In your nose, yeah. Okay, mucosa is pink. No issues with the septum. No signs of discharge. Good. Looks good. Please please open up your mouth. Say ah. Okay, so try to flatten your tongue on the bottom and say good. Say ah. Okay, one more time. Ah. Good. One more time. Ah. Great. Okay. All right, so no enlargements of your tonsils. The pharynx in the back looks good. No signs of infection. Your uvula is symmetrical midline. And yeah, so no issues there. Let me take a look at your teeth and your gums, okay? Okay. I've been seeing a dentist regularly.
Yeah.
How many times a year?
2 or 3 times.
Okay, good. Let me look at the top, right? Other side. I want you to raise your tongue up like that. Down. To the side. Good. Other side. Great. Okay. Looks good. Uvula, tonsils not enlarged, mucosa pink, no redness, no lesions, cancer check, negative. Okay, good. Can you please lie down, face up that way? Yeah.